Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Jermaine Butts remembers sitting at his kitchen table and feeling his face twitch. Thankfully, he was with his wife, who realized Jermaine just wasn't acting right. She knew to call 911 because Jermaine was suffering a stroke. A blood clot was cutting off his brain's blood supply. But Jermaine is doing well today, just months after that medical emergency, thanks to his family's fast actions and the work of expert stroke doctors here at the University of Kansas Health System. Today, we are learning more about Jermaine's treatment and his recovery, including the technique that reached into his brain to remove that clot. We'll also hear what caused his stroke, something doctors say is an under-recognized cause of dangerous blood clots. Jermaine is here in studio with us today alongside two of his doctors. We got Dr. Michael Abraham here next to me. He is an endovascular neurosurgeon and neurocritical care doctor at the University of Kansas Health System, as well as the director of stroke research at the University of Kansas Medical Center. Okay, then we have Dr. Prasanna Iswardas. He is a vascular neurologist here at the health system who also heavily was involved in stroke research. Great to have you both here. Jermaine, good to have you as well.
Yes, ma'am.
Thanks for being here to share what happened to you that day. What's it like to be reunited with these guys?
Yeah, I feel great. I adore him.
Yeah, you said you learned a lot from Dr. Abraham.
Yeah, when I went to your appointment.
He shared a lot about things that you didn't even know happened,
Didn't even
right?
know.
So take us back. Let's go back to that day you had the stroke. This was almost 4 months ago. In the kitchen with your wife.
Yes.
What do you remember?
Just a regular day. We was hanging out, and she was cooking, and she said the dinner was ready. She told me to go and get the kids or whatever, and I stood up, and my face twitched.
And you felt it?
Yep. And I'm like, hey babe, she's like, call 911, call 911. And I went to the I went to the couch and laid down, and that's all I remember. But, she said I got back up and came in there and talked to her like...
And she was on with 911?
Yes, and I came in there and said, hey babe, I don't know what's going on with me or something. I said like that, and all I remember was waking up in the hospital.
Because you collapsed at that moment there in the kitchen when she was on the phone. So your wife knew something was wrong, and that's what's so good about having family. They know you, right,
Yeah,
Dr. Abraham? They know when something just isn't quite right. Do you know if she knew it was a stroke?
She probably knew something like that was happening because I've been going through, I guess, a family. My mom and my dad have been going through similar things like, stroke or heart attack.
They had some health issues in the past.
She's worked in the medical field a little bit too. So
she was on high alert with you.
Yes.
Always keeping her eye on you.
Yes,
That's good. Whenever we talk about stroke awareness on this program, we always want to teach the acronym for the signs of stroke, which is Be Fast. And for anyone watching our program before, just take a second and remember if you know what these letters stand for. If not, check these out and take note, because it's Be Fast. Balance changes, eyesight problems, face drooping, arms that can't be raised, speech problem, and finally, really what's most important, time. T is for time, as in time is of the essence, and it's time to call 911, which your wife Golden did, and we're so glad she did. Obviously a very scary time. You get here to the health system. Again, what is the next thing you remember when you wake up, and what are people telling you?
I think I woke up to you trying to explain something. I don't even remember what he was saying.
That would be wild. Dr. Iswardas, just a man you've never met before, standing over you.
Yep, I didn't know what he was actually saying because I wasn't coherent, so to speak. And then just like maybe the next day I woke up, I was like, okay, what's going on here?
And do you remember the connection though from that moment in the kitchen? Were you able to go, oh, this is what was happening in the kitchen and this is now where I am?
Yes, I knew what, when my face twitched, I knew what was going on.
You knew something felt different.
Yeah.
It wasn't just a weird
right
tweak. It was something.
Right, and no pinched nerve or nothing.
Yeah, this was definitely something was not right. So Dr. Abraham, what do you remember from when Jermaine arrived at the hospital?
Yeah, so as always, our stroke team are the first line of defense. They get the calls when strokes are coming from whatever hospital around the area. Get the call, we have a young gentleman with what we call a carotid artery stroke. So the carotid artery supply nearly half of each side of the brain. So nearly half the size of one side of his brain had no blood flow. So immediately activated the team, the tech, the nurse, anesthesia. We were here waiting for him. And as soon as he got to the angiography suite, put him under general anesthesia, and then we did endovascular thrombectomy or clot retrieval, taking a long catheter, a long tube through his arteries and up in his brain and pulling out the clot.
You make it sound so simple. We're going to show that here in just a moment. Dr. Iswardas, what do you remember about standing over and communicating with Jermaine that first moment?
So, I mean, like by the time like he had his procedure done and he was already admitted in the hospital, a couple of things I can clearly remember is like his wife was very supportive. Like everything that I was saying, she was taking notes of everything. So I knew, like, I mean, like, it's a very good family dynamics and he's going to do better. And at that point of time, I mean, like, we knew he had a stroke and we were in the process of finding out, like, what caused the stroke. And at about, like, 25% of the time, like, we don't even know, like, what caused the stroke despite all the investigations. And he was under that category when I saw him. And me and Michael were trying to, like, find out, like, what could have been the cause of stroke. And that's when, like, we found this carotid web. And we thought that this is probably the likely cause of a stroke.
So medical team and investigative team at the same time, trying to figure out where this came from. Let's go back to what you were saying, because we're sharing images of Jermaine's blood flow or lack of blood flow in the brain. Show us what we're seeing here from left to right.
Yeah, so on the picture on the left, where that blue circle is, that's the top of his left carotid artery. So that supplies nearly more than half of the left side of the brain.
I don't see anything.
Exactly.
Yeah, right, okay.
That's a bad thing. We didn't see anything. So there's no flow up there. That's why he had such a severe stroke scale when he came in. And then, again, went up there, aspirated or sucked out the clot. And then the picture on the right, showing the big circle, now we see restoration of blood flow to that left side of the brain with all the clot removed.
And in order to get the clot out, you put a tiny balloon in the artery. What is the purpose of that?
Yeah.
You know, kind of layman's term.
Yeah, so
us.
this picture here, the picture on the left, shows what we call a roadmap of his carotid artery. My aspiration catheter's in there, and it's hooked to a tank that's providing continuous aspiration. Now, when we pull this out, there's always a risk that we call antegrade flow, or flow going forward, can break pieces off or break the whole thing off and send it back into the brain. So to avoid that, we can do something called flow arrest. So I have a small balloon at the bottom that I inflate, so I'm causing temporary flow arrest into the brain while I'm pulling that out. And as soon as that's out of his body, I deflate the balloon.
So how long did this whole process take from the time Jermaine got here to when you knew he was somewhat in the clear?
So the time we got him to the angiography suite, I can speak of that, you know, what we call groin access, when we get into his arteries, from the time to full restoration of blood flow was about 25 minutes.
And I said in the clear. Once it's out, is that in the clear? What's the next step?
Yeah, so everyone's different because it all depends how much brain tissue has suffered from the lack of blood flow by the time they get here. So sometimes we can get really great pictures and still people can unfortunately have a large stroke. Sometimes we can, but majority of the time I think when people come in, we get restoration of blood flow, people tend to do better.
Okay, so Dr. Iswardas, you found something called a carotid web when you were doing your investigating on how this all occurred. What is that? What's a carotid web?
So carotid web is just a small protrusion inside the carotid artery, and it kind of like disrupts the laminar blood flow. And not all the time, but in most of the time, I mean, it causes clots.
Is that what we're seeing here?
Yes, that is what we are seeing here. So this was the picture that, I mean, like Michael shared with me, and then like we were discussing about this. And I think what we see there is like there is a hang-up of contrast. So the contrast should completely clear out, but what we see here is the contrast is just hanging out there, indicating that there is some stasis of blood. So we did a study like with some specialized like MRI sequences, and this was the only study like which looked at the blood flow in people with carotid webs. This was done in like Calgary, and from that study what we found was we can see here. So this is the picture where you see like there's supposed to be a normal laminar blood flow along the carotid artery, but because of the disruptive carotid web, there is some stasis of blood and there is some turbulence around the carotid web. And as you can see, that turbulence and stasis is eventually going to like attract some platelets, some RBCs, and they're going to form a clot. And once this clot is formed, further turbulent blood flow is going to like break down some pieces of the clot, and that clot is going to go up and cause blockages in one of the arteries in the brain, resulting in some big stroke. So that is what we found in a study as well. And there is another interesting finding we saw in addition to stasis, like the carotid web is supposed to, like the carotid artery is supposed to like contract and relax with each systole and diastole of your heartbeat. But what happens in a carotid web is like the side where the carotid web, there is no movements. And only on this side there is movement, and that also contributes to like stasis of blood, which contributes to the clot and then the stroke.
Jermaine, what questions did you have when you were hearing this? I mean, carotid web.
Well, I don't know. I was just very thankful, and the carotid web or whatever, it's just something that comes from nowhere, or I don't know.
Yeah, and was the question about, Jermaine had mentioned, it being in the family and there being a health history. How much of that comes into play when you're doing your investigating? Is this something that would have come from a family member, family history?
So we don't know that, like for sure. So it's believed that this is some type of a variant of a fibromuscular dysplasia. The fibromuscular dysplasia is not like inherited like familial. There may be like some cases, but in general it's not like inherited.
So do you develop it like slowly over time, or does it come on quick?
So it's usually develops like slowly, but the problem is we don't have studies. Like nobody has ever had a carotid imaging done when they're kids. So we don't know like how much it's developed, but there are studies which says that there is a smaller variant of carotid web and which gradually gets bigger as well.
So we had mentioned earlier about this being an under-recognized cause of stroke. What do we mean by that?
So the problem is, the carotid web can be recognized very well with the CT angiogram, but then when there is a clot sitting on top of the carotid web, it distorts the features of like carotid web. So sometimes patient can have a small dissection of the carotid artery. Sometimes patient have some atherosclerotic plaque sitting on the carotid artery. They may all look same when there is a thrombus there. So sometimes we may miss those carotid webs, especially when there is a thrombus sitting on top of it. So it could be, there could be like more carotid web cases, but it's just that the time when they do the imaging, the thrombus may be obscuring the view of the carotid webs, and we may be under recognizing it.
So we've got some more questions about Jermaine's recovery, his family, and getting back to work, a really important thing I know you're wanting to do, Jermaine. So if you have any questions for Jermaine or our doctors, use the chat on YouTube or Facebook. We are on the X platform, or you can email the Medical News Network. The information is right there on your screen. So, Jermaine, when you were in the hospital after the procedure, while you were still in there, what effects were you feeling of the stroke?
Just like my right side, I felt a little weaker, just on my right side. That's about it.
No pain, just some weirdness.
No pain at all. Just a little weirdness.
Yeah, weird. That's our that's the non-medical way we used to describe it. Just weirdness. I felt weird. Okay. Yeah. We know stroke recovery though can take months. It can take years. How quickly were you able to walk and talk the way you used to?
Well, I was talking normal, like even when my friends would come up, I was like, hey. I see you, man.
I love that.
Like, dang,
They're like, well, they didn't know what to expect, I would imagine.
Well, they, everybody expect everything to be down, but I was, I had good spirits and everything, and I could tell that I was being okay, thanks to you.
Yeah.
I could feel that, and I was getting up when I was pushing the button to use the restroom. I had to use the bathroom, so I just got up out of my bed to go walk to the bathroom. And he's like, "You don't supposed to be." I'm like, "I feel okay."
Is that pretty normal, Dr. Abraham? And is it encouraged, or are you supposed to be kind of down and out for a while?
Well, we always want to encourage safety, so especially with stroke patients, they may feel great, but sometimes
sure.
They, when they're walking, they may stumble. So it's always good to have a nurse by. But he was young and encouraged on himself.
I had a lot of people there.
I bet you had a lot of support. And you said, when I talked to you on the phone, you said, God, Dr. Abraham, he saved my life.
Yes, he did. Yes.
You're very grateful.
Yes, sir. Yes.
Yeah.
Yes.
Yeah.
Glad we could help you.
Yes.
Well, and when May is Stroke Awareness Month, and you had brought Jermaine to the table and said he'd be a good person for us to talk to. Why is his story so important for people to hear?
For multiple reasons. One, with his wife, recognizing the stroke symptoms. That's clutch. That's why we have that Be Fast acronym in as many places as possible for people to understand and know what could cause a stroke. So that's the first thing there. And then just the speed of him getting to the hospital, having the appropriate stroke care team meeting him and the interventional team, anesthesia, all working together, and then just had such a great recovery. So
it's like the full circle moment when you guys can be sitting here at the table together.
Exactly.
Kind of happened the love fest. We like that. So what kind of rehab did you do?
Not really none.
None?
They was lining me up like I might need speech therapy or physical therapy, and by the time I left the hospital, they I guess they said I didn't need none because I was walking around the floor like normal. And
It's pretty superhuman, huh?
yeah, except my right side. Was
That
a little
right side.
weak,
So that
but I
really
just
was
started doing push-ups and stuff.
How does it feel today, the right side?
It's still a little weak, but it's back to normal.
Will
pretty
that go
much.
away eventually, Dr. Abraham? I
it
mean-
should, yeah. Stroke recovery can continue for several months, if not longer than that. So.
Okay, let's talk work, because you're in the roofing industry and
yeah.
very active. And you shared some video, cool view here of you up doing your job. So I guess you can't be afraid of heights?
Oh no, I'm not afraid of heights.
I guess not, yeah. But the work you do, it's important. I mean, you having a stroke and then getting back to work, the guys were kind of concerned about you being up high and doing what you were doing, right?
Right.
So they changed your position and you were doing some new things?
No, well, my position had evolved. Our company's getting bigger, so I can stay in the office a little more than I am.
Good. And take care of you.
Yeah.
So how quickly were you able, though, to get back to work? And that must have been an important thing, a good milestone for you.
Well, I took some time off. My brother let me, take some time, about 5 or 6 weeks. I just kind of laid around and did certain things and, tried to get myself up and moving,
Good. Well, this is the part where we get to talk about your lovely family, your wife Golden, who was the superstar that day and got you to Dr. Abraham and in good hands. Your family, some photos. Tell us a little bit about this great support you've had.
Yeah, she's the love of my life. That's why I married her. But she's very. That was the picture of me. That was my first time being out after I had my stroke or whatever, and.
Celebrating
She's been
it.
behind me since, just whatever I want to do, she's there.
And post-stroke, I mean, was there a lot of help from the kids?
Yes, they rearranged the living room so I could just stay down on that first floor for a while.
Nice.
And before we even got home, they had did that. And
That's nice. Taking care of Dad.
yes. But I was trying to do a lot of stuff by myself, but
I know. You're the dad. You want to get back to doing what you do.
I mean, just I just took it in stride. That
Sometimes you have to ask for help, and your family's there to help you get back.
Yeah, they knew it.
And these dogs love, like Dr. Esportas, you said, when you saw Golden, his wife, taking notes, you're like, oh, I know that when he goes home, he is going to be in really good hands, and she'll be able. You're basically passing the baton to the family members, right? To say, hey, we do our part, but you got to do your part, right?
Exactly, yeah.
So stroke, Dr. Abraham, we know it's an area of medicine, like so many others were, Black Americans. Face some bad outcomes at times. In fact, Black men are more likely to have a stroke. They're more likely to die from a stroke compared to white counterparts. We know this is not a simple fix, but what is being done to kind of move the needle where it comes to disparity of people of color?
I think it's a lot of outreach. For several years, under the leadership of Dr. Lechtenberg, we've taken outreach of stroke outside of Kansas City to the rural areas of Kansas and Missouri. Just again, coming back, when people hear heart attack, they know it's like left-sided chest pain going to the left arm. But stroke, because it can have so many different presentations, we try to, again, encourage people to know that Be Fast acronym. So that's, I think, the number one thing, again, spreading that message so that everyone is aware of it.
You mentioned, because you're right, we lump stroke and heart attack kind of in the same bin, and that's just not the case.
Yeah, they're very different,
Very different.
Similar risk factors, but very different presentations.
Present very, very differently. Jermaine, have you been somewhat of an advocate of, your friends, men, family members, of really paying attention and knowing your body and knowing your health?
Well, yeah, they kind of stand behind me.
They get an earful from you?
Yeah, but you know, we're real close. Me and my friends are. So whatever goes on with me, we all take it in. You know, like whatever goes on with him, we all take it in. So
You all feel it?
Yep.
Yeah.
yeah, that's how
Well,
we
good.
roll.
Well, that's how we roll. Okay, so we've got some questions from our viewers this morning we want to get to. I think we mentioned it, but is Jermaine's outcome typical? You know, how do you rank that?
I would say it's a little extraordinary. I mean, he's back to work, nearly back to normal. So a lot of that has with his age and the motivation, I think, are two big factors.
When you get the call that someone like Jermaine is heading to the hospital, you mentioned kind of everybody's on deck, and you can know some things, but not everything until he arrives. How are you prepping so that when Jermaine gets here, you can act fast?
Yeah, great question. So one thing is we can actually access all the images on our phones. We have an app called Rapid, which can show me all of Jermaine's arteries from the top of his heart upwards. So looking at that, I can understand where the blockage is. Am I going to need special catheters, special balloons, things like that? And while I'm looking at that, I'm texting my nurse and tech, like, this is what I need, so that all of that can be ready.
So you're kind of like working on Jermaine before Jermaine even gets here.
Yep.
That's got to be relieving to family and patients. Jeremy has a question. Do you have control over which hospital you go to when the ambulance is taking you in for a stroke? I mean, we know this is something very specified that you handle. So how is that communication happening where we say, we got to get him to Dr. Michael Abraham? And
yeah, that's still kind of the dilemma out there, because there's some people right in Kansas City that can go to a comprehensive stroke center like KU, but then the big question if somebody is further out, Hayes or further out than Hayes, do they go straight to Hayes or do they come straight to KU?
kind of like a bridge before they get to you.
Yeah, because with the IV TNK, the clot buster, that has to be given within 4.5 hours. So ideally, if you can get that in at a smaller hospital and then to a larger hospital, that may be the better scenario. But we're still trying to figure out what is the best pathway for patients.
Gene wants to know, is the carotid web still there?
I think he's already put in a stent now.
Not yet.
Not yet.
Yeah, it's still there.
Okay.
So I will be putting a stent in his carotid artery. And by doing that, that will cover up that web. So any of that blood that's flowing irregularly will stay outside of the stent.
And so why wait? Why wouldn't you do it at the time? Just clinically speaking, I'm trying to follow you on that part.
Good question. So when he was in the hospital, we were doing all the workup. And because the web is so rare, we were make sure we weren't missing anything from the heart. And he actually has a small hole in his heart called a PFO, which can be a cause of strokes. And he also had a clot in a vein in his leg.
These are things you found
while he was here,
okay.
yeah. That Dr. Isuartes' team found, and we put him on a blood thinner, actually. So he was on a blood thinner for 3 months, and we didn't want to stent him right away because anybody gets a stent gets put on aspirin and Plavix. So we didn't want aspirin, Plavix, and a full blood thinner. All those can increase the risk of bleeding.
So did he have a clot-busting drug at the time? Or?
When he came in. Initially, that was our first line, yeah.
Okay, so you're saying there's a very specific way and order in which we get Jermaine back to Jermaine.
Yeah.
So what's next? How do we keep him from coming to see you again?
Yeah, so he just got the follow-up CAT scan a few days ago. Yeah. I texted Dr. Isuartes and we said, okay, let's stop the blood thinner, and he's getting scheduled for carotid stenting here in the near future.
So is there any way to know that you have this carotid web, or are you just kind of, hoping you don't?
Yeah, unfortunately not, because scanning the carotid arteries, like Dr. Isuartes said, it's not routine. But I think one of the best things is just having a good primary care doctor doing those routine preventative health maintenance things.
So how new and prevalent is this balloon procedure you did, and can people get it just anywhere?
We've been doing it for several years here at KU, and it would be definitely a comprehensive stroke center that we're providing 24/7 clot retrieval care.
They need to come to you. In short, they need to be with you. Yeah. That's right. So, but yeah, it must be great seeing your patient here doing so well.
Yeah, and like I said, I saw him in clinic about a month ago, and I was like, wow,
dude. Yeah, I love that. Dr. Isuartes, what do you want people to take away from this conversation and this story?
So I think time is brain for every 1 minute you lose like 2 million neurons. And I think we all know like the reason why this is a success story is thanks to his wife, who brought him to the right place at the right time.
Do not ignore the signs.
Exactly.
Dr. Abraham, what's the takeaway?
I'll echo what Dr. Suarez said, and you know, like what Jermaine said a few minutes ago. You knew it wasn't a pinched nerve, because I've heard people say that, like, oh, I couldn't move this side. I thought, let me take a nap, let me sleep on it. No.
Stroke is going to be the farthest thing from your mind, I would imagine.
But it's not normal to not move one side of your body or not be able to speak and things like that.
All right.
Take it seriously.
Take it seriously. Jermaine, what do you want people to take away from your story if they're listening today?
Like, I like to piggyback on the doctors and tell them that, you know, you, like you said, you only have little time. So just be alert and just try to take it for what it is. Don't
listen to your body.
Yeah, that's the best thing to do.
Thank you for sharing your story. It's really important, okay?
Thank you.
And we're glad you're doing well.
Yes, ma'am.
Thank you. Thank you, Jermaine. Thanks to our doctors, and thank you to our viewers for being with us today. We'll see you back here on Monday.
Join us tonight at Kauffman Stadium for our next Royals Health Awareness Night. Tonight, we highlight colorectal cancer and how to spot the disease as early as possible. Stop by Gate A before the game to meet our staff, grab some free Royals swag, and enter for a chance to win a Royals gift card. See you at the K.
Coming up Monday on the Morning Medical Update. An OR nurse had a simple idea to improve patient safety and save time, so she spoke up. I'm Jessica Lovell on the next Morning Medical Update. Now, this nurse's innovation, born at the University of Kansas Health System, may one day be seen in hospitals everywhere. Join us Monday at 8 as we celebrate Nurses Week.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.